Thanks, everyone. So nice to see a lot of people still here. I'll tell you, I don't know if anyone has a feeling of the one that got away in their lives, right? It can be a pair of shoes you wanted that went got discontinued. It could be a girlfriend or boyfriend that got away from me. It's a company that got away. I don't know, my dream job was always out of college to work at Ernst & Young. I don't know why, but I don't know if you guys had a dream company to work for. But for me, throughout my career, I kept thinking one day I'm gonna go back to Ernst & Young and work there and fulfill my dream, and it just never happens. But I keep thinking about it. And then within the pharma industry, I constantly, I don't know, I just have this, Novo Nordisk is a company that I read about often. I find it fascinating. I'm happy working at Novartis, but I love reading their earnings releases and quarterly adjustments because there's so much going on there. It's a very interesting company. So that was the one company I just wanted to share with you before we jump into the panel. When you look at their results for 24 and 25, almost every quarter they have something released as part of their earnings around gross to net. So in Q1 of 24, they said they had a one-time accounting estimate adjustment really in Q1 that resulted in a 5 percentage point growth in their sales. And for me, when I hear the word accounting anywhere within an earnings release, it makes me feel how important we are. So maybe that's part of it, that they tend to give a lot of credit or feedback on accounting. In Q2, they said the gross to net sales adjustment related to prior years in the US was positively impacting sales growth in both Q1 and Q2 2024. These adjustments benefited North American rare diseases and impacted our gross margin. Then in Q4, again, they released gross to net sales adjustments positively impacted US sales growth margin and operating profit. Then I got a little bit concerned because in Q1 I didn't see anything. I couldn't find anything. I used AI. I went in and read their press release, and Q2 they made me happy again and had a huge disclosure again that they had a $464 million positive gross to net adjustment. And I think part of what you see in the industry is companies are reacting really quickly to data, right? There were times in the past where you'd wait for a Medicaid rebate to get paid the initial rebate, that first quarter resub, the second quarter resub before you did anything. And now because of the dollars in gross to net and the sensitivity, I think companies are reacting really quickly to the best data they have. So I'm excited to be part of the next panel. I'm gonna let Patrick and team come on the stage and do the introductions, but thank you all for listening to my sharing of the one that got away in Ernst & Young. If you guys have one that got away, you can share it with each other. But everyone, I think, always has a view on how their career is gonna go. I think I worked in gross to net for a couple of years by accident and haven't left, so I hope many people come out of this conference thinking, wow, gross to net's really an area that interests me and there's so much more to learn. So I'll welcome on the panelists and I'm gonna join them on stage. Thank you.
Thank you, Brett. Thank you, everyone. I think we have a mostly full audience still, so thank you for staying around. I know the next session may be a little tougher, but we appreciate if you could stick around for that one too. So I've got a great panel up here for you today. We're talking about reconciling pharma revenue management and financial risk. My name is Patrick Coyle. You probably heard me too many times where I explain who I am. Brett, I don't know if they know who you are. Do you want to?
Brett Nussbaum. Excited to be part of the panel. It's a really different transition and looking forward to participating.
Yeah. Ranish Singhvi, the head of finance at Accord.
Yeah, I'm Ranish Singhvi, head of finance at Accord Healthcare. So our company is into generic as well as specialty, and we do have a small division of medical device as well. I do have a experience of close to 20 years just in pharma. So let me see. I love to share my experience from my 20 years of experience in pharma industry.
Thank you, Ranish. And Eduardo Gonçalves, CEO of Kernel Solutions.
Thank you all. Thanks, everyone. Thanks for participating on this event. It was really great to present the Kernel software a few minutes ago. I think I introduced myself, CEO of Kernel.
Yeah, thank you all. So we're going to really try and make this very interactive, and we're going to be talking about a lot of challenges that you're all facing across pharma today and how it all culminates between revenue management, whether you have a system, whether you have a service, and how it comes together in your ERP. Chargebacks and rebates, Medicaid visibility, revenue cycle management, and how that integrates with the ERP, compliance audit and strategy. So thank you everyone for joining. The first, what I want to ask Ranish, and I think when you see the panel, we have a really good diversity of experience. So I've had just roles up and down the organization in finance and operations and strategy, and you've heard Brett is the guru, can I say guru, of accounting?
Very flattering.
GTN, yeah. But I think Ranish brings this tremendous split between specialty and generics. So there's a lot of differences in there that we get to highlight the experiences. And then Eduardo's going to talk about how it all comes together with technology and data integration. So maybe I'll open it up first and just say, Ranish, what do you think when you have a large volume of chargebacks and data interactions coming through, and you're at the senior level, how do you get confident with what's going on downstream, and you have vendors doing different parts of services and revenue management, and then you have internal support doing things too. Where do you think, and let me say first too, these are our opinions, and they're only ours, they're not our organizations up here too, but where do you think the risks are?
Nice question, Patrick. So first of all, well, we've been in this, handling this generic pharmaceuticals since last 15 years. But then recently we launched our specialty products, means biosimilar products, I believe 2 years back. So far as taking assistance from BP or a consultant, it was not there for generic side. But then yes, from specialty side, we just introduced a consultant who is helping us from over there. But to answer to your question, whether what could be the challenges, probably I can tell you more from the specialty side. And those are like mainly the time, I would say the timings, and the contract interpretation from the these consultants, and the data accuracy. So there are several examples I can share you, Patrick. One of the example is maybe consultant may not be using a 340B scrubbing, they may not do, so that can affect. Secondly, they may have a very, misalignment in terms of understanding the contracts, which could be like one of many or one of two, and that can create an issue in issuing the rebates. And sometimes it may happen from the other side as well. So like wholesalers may not update their master, the pricing master, and that can cause an issue. So there are several challenges actually we are facing, at least from the specialist side right now. And generic side, we are more so ever, we are aligned because everything has been handled in-house.
Yeah, it's a great example of how larger pharma organizations still has a myriad of different services depending on types of therapeutic area and specialty. Does anyone else want to give perspective on that? But okay, so Eduardo, from the technology side, what are the main barriers when you're reconciling a lot of this data that's coming in, whether it's from services or a system? What are companies doing to ingest it? And you have specialty pharmacies, you have distributors, you have wholesaler data. What are the biggest challenges you see in integrating these things?
So the challenge in integration, Patrick, I think comes from a few sides. And I would say there is tremendous amount of value in data. So the parties hold to their data. So while from as an accountant, I want full transparency, it's not always to get that, because that data resides in the hands of different parties. And it's, even though the ideal world is transparent, that not always comes easy. A second point is we live in an age where security is top. So, for example, there was one Medicaid provider, one of the providers, I think it was Prime or Prems, it was hacked. So when that happens, instead of a world in which there is transparency, it becomes even harder to get to that data. And then we go backwards. I think in data integration, if the industry would really come together, like Medicaid is my favorite example. There are 12, maybe 13 different providers of the Medicaid data, Quantivus, Prems, you name it. And it could be a single system, but it's not. So every manufacturer here pays a high price of going after multiple sites. Right now, Connecticut has just come yesterday, Pennsylvania came today, and all of them require specialized, almost like you need to know the site and they are different and so forth. So I think that's the other side that increases the cost. I think finally one more point is that these systems, when you're talking about reconciliation, there is no silver bullet in terms of there is a key over here that is the same key over there. We're talking about data at different levels of detail, and you cannot have like a magic VLOOKUP that connects both data sets. So some of the challenges and costs.
And I think it's a really big challenge that we face. I mean, I sat today on a call internally on the Q3 Medicare benefit redesign, right? We're supposed to present tomorrow by end of business our final numbers. And we're still buried in the details. 7 different people pulling data from 7 different sources, arguing about which of the data is more accurate. And so what I find with the data is like I struggle with when is the time to stop digging through the data and step back and think about how do you want to share that data and present it, right? I often find that as we come to the end of quarters or end of months especially, management expects to digest this data in a way that may not make sense to us in this room, where I enjoy being in the data, and another data source for me is very exciting, and I can't wait to see how the Humvee data looked compared to the internal data, and then you got someone in market access who thinks they have full understanding of non-contracted volume. But there has to be a time where as finance professionals, we realize people outside of gross to net need to still process and understand the analysis that we do. And so finding the time to like get all that data organized and then pause, look at it, put it into PowerPoint slides is something that I still find myself struggling with and having the right view on.
Yeah, in the past, I've talked about data and the critical importance for ES&G. And I think understanding that so many different parts of the organization have different data that are driving different decisions. And a lot of those wind up one way or another manifesting in the financial reporting. But get to know your data. I think not just your data provider, because they're all different, but your data and who's using it for what is really important. And I think different organizations, different sizes have these capacities built in with master data management team. Maybe it's one person. Who's cleansing, who's scrubbing, who's making sure it's timely, it's accurate. You have a lot of these clauses in your contracts. More often than not, which is also a risk, someone in the organization is approving these payments, whether the service line agreements or service level agreements are being met or not, which also opens you up to tremendous compliance risk, depending on if it's a pharmacy or who's not adhering to those SLAs. So get to know the SLAs in the contracts, get to know what data and how it's coming in, the team that's responsible for making sure it's clean. Because one day you may see something that says, this is our duration of therapy, and they didn't tell you we went from 80% complete reporting to 60. And so your confidence level is definitely gonna be a heck of a lot different for 60 versus 80. But what are some of the processes, maybe Brett, that were one key process that you put in place around how to do these data checks or timing to make sure that?
Absolutely. Thank you so much for asking me about pipeline accounting. It's definitely my favorite topic to discuss, so I really appreciate that transition that you had. I find people do that at work a lot. I don't know how it is for you guys. A technique at work is like when you talk to people about gross to net and they have no idea what MFP is, they just channel the conversation right back to their topic of interest. So for me, that's always pipeline accounting because nobody really understands it outside of the people in this room. But since we preset these questions, I do feel comfortable answering that question.
Good.
And definitely realize how much work goes into, Patrick putting into this effort, right? We work at 3 different companies, we're on 3 different schedules. It took us, 10 tries and the form people helping us get together. We also are very particular about what data we're willing to share with the groups. So definitely thank you for giving us the chance to talk about it. Internally within a big company, when you have 50 people in your managed markets finance department, there's a lot of people looking at the data from different perspectives and different goals in mind. And I do find that a challenge sometimes, whereas an analyst in the Medicaid team's goal is to process the Medicaid payment within 37 days. And if they want to have exceptional performance and maybe within 27 days, my goal as someone who's trying to consolidate and analyze it is different, right? I don't care if it takes you 37 days or 27 days. If you can scrub out $5 million in duplicate utilization or NDCs that don't fit, that's much more valuable to me. So definitely this battle between like different objectives across teams. And I think at least within Novartis, what I see is this alignment in objectives across departments definitely helps make sure you get the best data for different reasons, right? So like the three of us also have very different roles in our companies and different perspectives. So I try to understand like within Novartis that people do have different goals and partner with them. And to the extent that I can have involvement in other teams' objectives and writing of objectives for the year and how they're measured and selfishly ensure that aligns with my needs, I think it goes a long way in a company, right? To be working in the same direction.
Yeah, I think that dovetails perfectly into a curveball I'll throw to whoever wants to swing at it. But you talked about scrubbing out the duplicate discounts and maybe some potential. There's certainly some firms out there that help you with that, whether it's 340B, identification of potential revenue leakage and duplicate discounts, or whether it's Medicaid. So what have you seen? What do you do? So you scrub it out, you find it. What happens on the financial reporting at that point? And where does it live? Yeah.
I can take that. Medicaid is one of the most fascinating processes for us. And I'm not an accountant, but I keep thinking about when you see your journal entries related to Medicaid, how much upstream process exists that leads to that journal entry. So the first thing that comes to mind is like, if your contract or your program is not set up correctly with the correct URA formula, you're going to, that entry is incorrect. So I'll keep going down the list. That URA comes from GP calculations, particularly BP, that is a best price, minimum price, and an average, that is average manufacturer price. That information must be correct. The problem is that what goes into those calculations, so, and I'm thinking about controls as we go down, and I'm very curious about in your organizations, like how do you put so many controls in place to guarantee that? So let me continue. So from the URA calculation to AMP and BP, but then you need to think about what goes into the AMP and BP calculation. Those are sales and concessions. Those sales and concessions, you cannot get them from your ERP system because you need a different level of detail, such as you need the class of trade. Your ERP system does not have the class of trade. So here, you need a control on your class of trade. So hopefully I'm not losing you on the chain. So from now, you have your URA. Now you're receiving invoices. So right now, yesterday, Connecticut arrived. Like today, I think we're processing Pennsylvania. We're in the peak right now for those that are following of the Medicaid processing. It's happening as we speak. At that point, you're receiving invoices, you're receiving claim level detail, and that's going to lead to disputes. Those disputes, they also will be part of that journal entry. You need to monitor and control those disputes. So the list goes on and on and on, and hopefully I did justice to like all the controls in place for you to guarantee that that accounting entry is correct. And I just talked about the actual. I was not talking about forecast. That's a different science that I'll let you guys talk about.
Yeah, and I think it's really critical because different vendors are doing different things depending on what size organization you are. And maybe not everyone has an expert, a Medicaid expert internally like Jen Buckley, but if you don't, you better make sure your vendor has some controls around that process and pressure test what they're doing because those things are going to be sitting and hanging out there. Or if you're lucky enough to have a big team inside, they know exactly what to do with it. But
yeah, we actually, Patrick, we do this validation in-house. We don't have a vendor, but then yes, things like Medicaid is such a thing, it helps to avoid duplicate from the payer side. So we do ask for a claims data from the Medicaid and this check, not for the Medicaid. Medicaid claims, we generally do validate from your utilization data. But then we ask for the claims data, and from the claims data, probably we are able to see, okay, there is no duplicate invoicing coming from the payer rebate. So it's the other way around. So that it helps up over there. To your point, yes, we cannot go on the face value of whatever the vendor has submitted. We have to see this cross-check, and there is a definitely inherent mistakes comes in. We do have an internal control check from our side.
Yeah, and I think it's never too late. We talked about this the other day. It's never too late to put more controls in place, and I'm not just saying that because I work at Baker Tilly and we love risk and compliance and mitigating that. But it's my career. I always slept better at night, knowing that I had, first of all, the right team in place. Obviously, the team is the most important. Very closely behind is the process, right? The people, process, and technology. And I think the data I always mix in now, so people, process, technology, data, because you need to know equally that you have safeguarded all these things. So Radish, at a company with the size of yours at Accord, what do you do to help make sure that those invoices and utilization are valid and accurate? I think you kind of touched on that a little bit.
Yeah, well, I think it's been a long journey. I think when we were involving ourselves, everything was sitting and it was sitting under finance roof. So be it a pricing, be it a credits check, be it I would say a little bit of market access, the pure accounting, gross to net piece, revenue recognition, the true up process, everything was sitting in the finance. And as the company grew, we started setting up a new department, okay, pricing department, there will be a credit department. So now I'm thinking like, okay, no, it should be, because as Brett has rightly said, everybody has a different objective, everybody has a different way of looking at the data. So now I'm facing a challenges because Brett, this Medicaid invoices, it is sitting in a different department. Okay, they don't know, means they know how to process it, but then the disputes which they are disputing back to the state body, it is not coming back to accounting. And so those challenges we are facing. We do have an internal check, we do have internal control and validating everything, but then yes, there is a challenges in terms of department who are processing all those credits versus what comes back and sit in our accounting system.
Yeah, thank you. That's great insights. I think do you want to add anything?
Yeah. This past week I was in the office, we were talking about Medicaid claims being processed, and I go walk to say hello to the Medicaid processing team, and some of them are celebrating and others are upset. They're waiting to see, is their state going to submit an invoice early enough where they have to work between now and the end of the year to get it paid by December 31st, or will it arrive later, in which case they can sit back and enjoy the holidays and only pay it next year, right? So to them, that's fun and entertaining. For me, whether you're going to pay it or not this year, I need to close my financial statements with any material state being factored in. So I found myself getting very frustrated, seeing people, they're drinking and dancing and talking and, having a great time because they don't think their state's coming in, because they called Arkansas and they said, oh, I'm on vacation this week, I'm not going to send in your invoice for another 2 weeks. So I don't have the authority over that department, right? And I have no right from an outside perspective to be judging, so I sat with the person in charge of that group, and she said to me, there's a different process we have to get comfortable with relatively the claim, right? To process a claim completely through the system in the 37 days is different, but rest assured we are still going to get your report as soon as possible that shows you so we can adjust in November and December for all of those factors. And so I think it's easy internally to find that frustration and sort of that friction between departments. I think I'm patient some of the time, other times not so patient. I do feel better about myself pipeline being my passion, considering the controls and stuff is Patrick's area of excitement. I find that far less exciting than pipeline accounting. I don't know, by a show of hands,
who loves pipeline accounting?
Controls, or if you had to choose between controls and pipeline accounting, there's a lot of controls folks out there that really enjoy the controls part of their job. Is that Ivorita? Oh my, you enjoy the controls part?
There's like 2 hands up.
So we'll assume everybody else is on my side. If you didn't raise your hand for controls, then you'd much prefer it. For me, I find the controls aspects of the job really complex and not something like I'm passionate about, but we all know we have to deal in balance with wearing both hats, right?
Yeah, I mean, to that point too, and maybe another curveball, and we'll throw out there, one of the things I used to do to help, as the audit chair, to help get the board comfortable on a monthly basis was I started showing these, they started looking at these huge swings in the balances on the liabilities and the timing, right, of these, like you're talking about, I think some organizations, I don't know about yours, get a whole, extended period off to the holidays, but you're going to see those balances grow at the quarter year end. And they're interested in seeing visualization that shows that. Not everybody in the organization is, probably almost nobody, but Treasury is, right? Do you see reporting and technology there, or is everyone kind of just grinding through with the way I used to with graphs?
Yeah, I find that interesting because since we're going to be talking about Medicaid, I wanted to say something about disputes, but about dashboards and visualizations. I think when you are in the operational team, you want to make sure that you're providing that visibility to your upper management to make them comfortable with the processing. And I think when you're on the other side of this house, you also want to look at those visualizations to see how your team is doing. What's interesting is that ideally everybody's looking at the same thing, but more often than not, you see the operational team looking at one thing and management looking at another thing. And I think that's part of what we work to bring together, that everybody's looking at the same dashboard. And I'm thinking here about just the Medicaid processing, that invoices come, and whomever has been in that business knows how stressful it can be because it's 37 days and it goes very, very fast.
Yeah, I think, when you're CFO, certainly, but looking at the end of the quarter, or looking at the run rates, Medicaid is 25% of my total liabilities, whatever it is, that's a pretty big number. And then all of a sudden you go to close the year or the quarter and it's like 45%. You go, uh-oh, is there a massive problem with the business? Maybe not. Maybe it's just literally a timing issue. So the process has to be baked around which states are missing, or which, what are we just not paying, and there's a timing issue. So 37 versus 27 could be a huge impact for some other people. So maybe moving on to system integration and how we do this and reconcile things like let's say SAP is probably a soup du jour for most ERPs here, but certainly also NetSuite. Maybe Sage too, probably some Sage in here. What's the most common or costliest integration issue that you've seen on the technology side when you connect these services or systems to the ERP?
I would say it's weird. I think I have been in a position once in my life, and I want to answer that question by saying the cost is people. Like you're asking me a technology question, but I think it's people, because I've been in positions where you need to either perform a calculation or it's a quarter close and it has to be closed by day 2, and your transactions do not reconcile. And then there's almost like a panic mode, because until you have confidence in your data and you want to do a good job, you cannot provide that information. So I don't know if you guys have shared that, but it's not a good feeling. And it's this idea too that how am I going to provide the answer to that question, maybe a report, maybe a dashboard, maybe a graph, if I don't have confidence in the data? So I think there is a high cost on that, and there is friction between teams. I venture to say maybe there is even start to have a lack of trust in the team, because once you make one mistake, that comes back to haunt you, and all your data is questioned. I don't know if you've been in that position, Patrick or Brett.
Yeah. Go ahead.
No, you go first.
No, I think just talking about, definitely when these kind of integration happens, onus means who is taking the onus? Finance will always be on the front seat, but then there are other department also. They are accountable, responsible, but the thing is there is some expectation also would be from the other departments, because the integration, it won't happen just from the finance, but it would be from the people who are from the various departments. But you have rightly worded, I think people is the costliest thing on this technology integration platform.
I know it's, even for me as I sit, it's sort of therapeutic to hear. I know this is not a therapy session for me, it's for all of us to talk openly and learn, but it's, I don't know if you guys find the same, it's therapeutic to listen to other people who go through the same sort of struggles at work, right? I mean, you can